Assalamualaikum doctors. In this video I am discussing about neurofibromatosis type 1 diagnosis criteria and some questions. So first of all, look the pictures. If we notice the pictures, what we find? Learning disabilities, larger than average head size, that is head circumference is increased, so that's why we measure the head circumference, and during head circumference we check the shunt is present or not. Leash nodule, and in eye we find niche nodule in optic glioma, that's why visual acuity in examination we do. The child is short statures. Okay, and scoliosis on the back. Look the picture. Scoliosis on the back. How can we understand? The scapula is one higher than and one other low. Then groin freckling, inguinal freckling plus in axillary freckling. These are we find. Limb deformity in the case outward bending lower legs, flat feet. So look the feet, that is flat feet and outward blending of the lower leg, bowing leg or any deformity of the leg we find. Neurofibromas we find small neurofibromatosis, pectus excavatum, that is shrunken chest. Look, that is pectus excavatum, axillary freckling and capsulate spot. So these are the diagnosis feature. Now diagnosis criteria I am telling. Clinical diagnosis criteria. Diagnosed if two or more of the following features are present. First of all, a first degree relative with neurofibromatosis. So it is an autosomal dominant conditions, first degree relative. Number 2, axillary or inguinal or perineal freckling, often developed in early puberty. 3, optic gliomas, 15% higher risk of brain glioma. Number 4, distinctive osseous lesions, example kyphoscoliosis, tibial bowing, sphenoidal dysplasia. Number 5, 2 or more neurofibromas or one plexiform neurofibroma. This can be found at any point along a nerve, can be cutaneous, subcutaneous or plexiform, specific for neurofibromatosis type 1. Buttonhole invaginations when pressed with a finger is pathognomic. Number 6, 2 or more iris nodule. Number 7, hematomas of iris seen on the slit lamp examinations. Number 8, 6 or more capsulate spots greater than 5 mm in diameter. Prepubertal child, or 6 or more capsulate spots greater than 15 mm diameter. Postpubertal child. Clinical diagnosis criteria for neurofibromatosis type 2. So remember, in exam it comes neurofibromatosis type 1 in always. Some question related to neurofibromatosis type 1 are I am telling. First of all, why causes of hypertension in neurofibromatosis type 1? Because renal artery stenosis, noradrenaline released by fibromas, that is sympathetic chain, pheochromocytoma, Wilms tumor and coarctation of aorta. Again, hypertension in NF1, why? Because renal artery stenosis, coarctation of aorta, Wilms tumor, noradrenaline released by fibroma. So fibroma is releasing noradrenaline, pheochromocytoma. Why abdominal pain occur in neurofibromatosis type 1? Tumors, shunt peritonitis, renal artery stenosis. So tumor, shunt peritonitis and renal artery stenosis. Another child, what is the chance? First of all, if positive family history, 50% affected and 50% normal. If no family history, general population and risk. Now, what are the common tumor in patient with neurofibromatosis type 1? That easily we can remember OMI, astro. OMI for optic glioma, M for meningioma, E for ependymoma, A for astrocytoma. Again, the tumor associated with neurofibromatosis type 1 is OMI, astro. O for optic glioma, M for meningioma, E for ependymoma, astrocytoma, astro. Endocrine problems of neurofibromatosis type 1 are precocious puberty, short stature, medullary carcinoma of the thyroid and pheochromocytoma. So endocrine problems are precocious puberty, short statures, pheochromocytoma, medullary carcinoma of the thyroid. Will be catch height. If he reaches the puberty, he will not be catching the height. If he still did not reach the puberty, he can catch height. Causes of headache in neurofibromatosis type 1 are hypertension, seizures, tumors and increased intracranial pressures. Hypertension, seizure, tumor and increased intracranial pressure. So this is all about neurofibromatosis type 1 diagnosis criteria. Thank you.